Why do so many men suddenly start peeing more often, feeling urgency, or never feeling completely empty? And in more advanced stages, why does urination become difficult, slow, or even completely blocked? Today, I'm going to walk you through this step by step in a way that actually makes sense. Because once you understand the structure, all these symptoms suddenly become very logical. Hey race, the reality most men don't realize: prostate enlargement is almost inevitable. As long as your hormonal system is functioning normally, especially testosterone, your prostate will gradually begin to enlarge starting around age 40. By age 50, about half to nearly 70% of men already develop urinary symptoms. By age 70, this number rises to around 80%, making it extremely common. So instead of fearing it, the key is understanding it early. Let's first locate the prostate, because its position explains everything that follows. At the top, you have the bladder, which stores urine. These tubes coming in are the ureters, bringing urine down from the kidneys. Behind the bladder is the rectum, which is important for clinical examination. And just below the bladder sits the prostate gland. It's small, roughly 4 centimeters long and weighing about 20 grams. Think of it as the size of a chestnut, very small but strategically positioned. Now race, the critical point: the urethra passes directly through the prostate. This means any change in prostate size directly affects urine flow. To understand this better, let's quickly review how urination normally works. Urine is produced by the kidneys, then transported through the ureters into the bladder. The bladder stores urine like a balloon, but with thick muscular walls. These muscles are called the detrusor muscle. When you decide to urinate, the detrusor muscle contracts to push urine downward. At the same time, sphincter muscles coordinate to control the flow. The internal sphincter works automatically and cannot be consciously controlled. The external sphincter is under voluntary control, allowing you to hold urine when needed. For example, when you're in a meeting and can't go to the bathroom, this is the muscle you're actively tightening. Now let's go back to the prostate and what happens when it enlarges. Most enlargement occurs in the transition zone, which surrounds the urethra. As this tissue grows, it begins to compress the urethra. Imagine stepping on a garden hose: the flow immediately weakens. This is exactly what happens to urine flow. That's why patients experience weak stream, hesitancy, and difficulty starting urination. Now let's talk about frequent urination, which many people find more annoying. This is not just a prostate issue, it's largely a bladder response. Because the urethra is narrowed, the bladder cannot empty completely. This leaves behind residual urine after each void. Over time, this reduces the effective capacity of the bladder. So even small amounts of urine trigger the urge to urinate again. That's why patients feel like they just went, but need to go again shortly after. Now let's move to urgency, which is often more distressing. Urgency means a sudden, intense need to urinate that's hard to control. Even when the bladder is not actually full. This happens because the detrusor muscle becomes unstable over time. Due to chronic obstruction, it is constantly overworking. Eventually, it begins to contract spontaneously. This is called detrusor overactivity. And it creates the sensation of urgency even without much urine present. Now, if this condition continues untreated, it can progress to urinary retention. This means the bladder becomes so obstructed that urine cannot pass. The bladder stretches excessively and loses its ability to contract effectively. At this stage, the damage may become partially irreversible. Additionally, stagnant urine creates an ideal environment for bacteria. This increases the risk of urinary tract infections. Patients may also experience blood in the urine. And in some cases, chronic inflammation such as prostatitis. So how should we approach prostate enlargement? First, understand that it is a natural aging process. It is not something abnormal or rare. However, symptoms should never be ignored. If you notice changes in urination, seek medical evaluation early. Doctors may perform ultrasound imaging, digital rectal examination, or blood tests such as PSA. Early-stage treatment is often simple and effective. Medications can relax the smooth muscle around the urethra, improve urine flow and reduce symptoms. They may also slow further prostate growth. If medication is not sufficient, surgical options are available. Minimally invasive procedures can effectively relieve obstruction. The key principle is simple early detection and early treatment. If this video helped you understand what's happening in your body, you're already ahead of most people. Subscribe for clear, science-based medical explanations. And if you have symptoms or questions, leave them in the comments below. Your next question might become the next video.